Schizophrenia is one of the most misunderstood medical conditions in the world. Many people think it means split personality, but that's a myth. Today, we'll explain what it really is calmly and clearly. Schizophrenia is a chronic brain disorder that affects how a person thinks, perceives reality, feels, and behaves. It is not caused by witchcraft, weak character, or personal failure. Schizophrenia affects about 1 in 100 people worldwide. That means in a country of 30 million people, around 300,000 may be living with it. There is no single cause. Schizophrenia happens due to a combination of factors: genetics, brain chemistry, brain development, and triggers. First, genetics. Having a family member with schizophrenia slightly increases the risk. Second, brain chemistry. An imbalance of neurotransmitters like dopamine and glutamate affects how the brain processes reality. Third, brain development. Small changes before birth or during adolescence can play a role. And fourth, triggers. Stress, cannabis use, or major life events can trigger symptoms, but they do not cause schizophrenia on their own. Schizophrenia often develops in 3 phases: the prodromal, active, and residual phase. The first phase is the prodromal phase, where early signs are subtle. This can include social withdrawal, poor sleep, a drop in school or work performance, and low motivation. Next is the active phase. This is when psychotic symptoms appear, such as hallucinations, delusions, and disorganized speech or behavior. Hallucinations mean seeing or hearing things that aren't there, while delusions are strong, false beliefs. Finally, there's the residual phase. After treatment, intense symptoms reduce, but some difficulties may remain, like low motivation, social withdrawal, and trouble concentrating. Schizophrenia is treatable. With the right support, many people live stable, productive lives. Management typically involves medication and psychological support. Antipsychotics help correct brain chemical imbalances. Common ones include risperidone, olanzapine, quetiapine, and haloperidol. It's crucial that these are prescribed and monitored by a doctor. Psychological and social support are just as important. Counseling, family support, rehabilitation, and skills training help people manage symptoms and live well in their communities. With proper care, people can work, study, marry, have children, and live independently. Often, the main challenge is stigma from society, not the illness itself. You might also hear about schizophreniform disorder. It looks similar to schizophrenia, but it's shorter. If symptoms last less than 6 months and the person recovers, it may be schizophreniform disorder. If the symptoms continue for more than 6 months, the diagnosis becomes schizophrenia. Early treatment leads to much better outcomes. If you or someone you know is hearing voices, has strong false beliefs that aren't based in reality, or shows sudden, unexplained personality changes, it's important to seek professional help. Talking to a doctor or a mental health professional is the first step. Schizophrenia does not define a person. With treatment, support, and understanding, people can and do live meaningful, fulfilling lives. Let's replace fear with knowledge and stigma with compassion. If this video helped you, please share it to help someone else. Subscribe for more evidence-based health education. Thanks for watching.